Hello, my name is Rayyan Bhutta, a first-year osteopathic medical student at Ohio University Heritage College of Osteopathic Medicine. And today I'll be presenting a study on the public perception of the relationship between hospital performance and ownership status. This research explores how people view hospitals based on their ownership status and how it influences their trust and expectations in hospital performance. Hospitals in the US generally fall into three main categories: nonprofit, for profit, and public. And while each category have their own financial and operational differences, there's very limited research on the public perceptions of these ownership types. Understanding public perception is crucial, as it can influence trust in healthcare systems and patient decision making. Our study aims to fill this gap by assessing how people view different hospital ownership models and their impact on performance. Previous research studies suggest that hospital ownership status can affect financial practices, patient care, as well as community investment. Studies have shown that nonprofit hospitals are often viewed as more community-focused and patient-centered, while for-profit hospitals are more often perceived as being more revenue-driven and business-like. However, there is still debate over whether ownership type directly impacts hospital performance, making this a very important area of study. Our sample closely approximated a nationally representative sample of US adults based on region, age, gender, and race/ethnicity. The total sample size was 2,569 US adults, and 73.7% of those participants lived in a three-digit zip code with at least two hospitals of different ownership status. This wide distribution allowed us to capture a broad and diverse range of perspectives. We used Cint as the survey company to collect our responses, and the analysis primarily relied on descriptive statistics such as distribution and means, which were used to analyze our survey responses. And this approach helped us understand overall trends and how people perceive different hospital ownership types. Participants were randomly assigned scenarios regarding hypothetical changes in ownership status of hospitals, and were then asked various questions regarding how they would feel about those ownership changes. Now, as for the results, most participants believed that changes in hospital ownership would have a very minimal impact on overall hospital performance. However, when we looked at specific factors like community investment and billing fairness, responses varied. For example, while some people saw nonprofit hospitals as more community focused, others were uncertain about whether ownership truly affects the quality of care and financial practices. This suggests that while the public acknowledges differences in ownership types, many are quite unsure about how these differences translate into real-life world performances. One key factor influencing these responses was trust in hospitals. Participants with high level of trust in the healthcare system were generally less likely to expect negative consequences from ownership changes. They believed that hospitals, regardless of ownership, would continue to provide quality care. However, those that had low trust in hospitals often expressed concerns that for-profit conversions could lead to cost-cutting measures, reducing patient care, and overall prioritizing profits over health outcomes. This highlights the significant role that public trust plays in shaping perceptions of hospital performance. Another major factor that influenced responses was personal financial experience with medical bills. Participants who had experienced financial hardship due to hospital expenses were much more likely to anticipate negative consequences from a nonprofit hospital converting to a for-profit status. Shown in this graph, these participants worried about higher costs, reduced accessibility, and unfair billing practices. This suggests that financial stress not only affects patient decision-making, but it also impacts how people perceive hospital operations and ownership transitions. In conclusion, our findings show that public perception of hospital ownership is very largely shaped by trust and financial experiences. While many people do not recognize major differences between nonprofit, for-profit, and public hospitals, those who have had negative financial experiences or low trust in hospitals tend to be more skeptical of ownership changes. These insights suggest a need for better public education on hospital financial practices and policies to help patients make more informed decisions about their healthcare. That concludes my presentation, and thank you for your time.